talking about?
Yes, so previously healthy individuals will come to adopt symptoms that make them look like they have the primary illness that the person spreading the symptoms is suffering from. In other words, over time, they look alike. And it's almost hard to tell who was the primary person with the symptoms to begin with. But the difference is the primary person is treated sometimes with medication. They're treated in their own right. For the secondary person, the treatment is separation from exposure. So so that's why it's important to figure out from the course of things whether or not symptoms were induced or whether they were primary illnesses. And this is actually a phenomenon I've seen a lot because I work in prison settings and state hospital settings where severely ill individuals go untreated for a long time, and over time all family members adopt even bizarre beliefs and delusions and symptoms, even sometimes hallucinations. And the cure of it is to remove the person. Once you hospitalize the primary person with the illness, the others return to their normal state. And it's quite dramatic how that happens. But until then, you can see from the rigidity, the inflexibility in terms of not being able to take in more new information or facts, an inability to negotiate, that these are actually symptoms and not the person's chosen stance.
Bandy, if I can just ask, just to clarify, because I think this is a really powerful concept. You are saying that Donald Trump's pathological narcissism is in fact transmissible and contagious in some ways, just like COVID.
Yes, exactly. That's the phenomenon that I've been trying to warn against. Unfortunately, it's been called various things and no name is really perfect, but it can be called induced delusions or shared psychosis, or I actually prefer the French phrase, folie à millions. So when it happens among millions, there's a name for it, madness among millions, folie à millions. But it's usually seen in pairs, in threes, folie à deux, folie à trois, or folie à famille when it happens in a family, or folie à groupe, it can happen within a gang. But now we are seeing it happen with the nation. Yes, it's the same phenomenon.
Is this progressive? One second. Is this pathology progressive, Bandy?
Yes.
Will it get worse over the next 4 years?
Yes. We've seen it worsen over 4 years. We see Trump supporters, rather than recognizing how he has been fooling them and how he's not the successful businessman he led them to believe he is, they have actually doubled down in their support for him and have even gone to extents that they would not have gone to defend him and support him. And you see them conforming more and more, so they're giving up their personalities and their own agencies to basically do what he says.
So if he loses, what happens to QAnon then in terms of this folie group? I mean, you talk about it a little bit in Trump's Mind, America's Soul, but what happens, does QAnon dissipate or not?
Yes, it should dissipate. It probably won't disappear. It has its own independent existence, of course. But the reason why all these fringe beliefs are becoming more central is because of Donald Trump's psychology, that he himself requires extreme conspiracy theories in order to explain how people are not liking him and criticizing him, and he has to create a story, a narrative of deep state persecuting him in order to keep himself right and sane and capable when in fact he's not.
Here's a